Hello, welcome to episode 44 of the Inside Social Work podcast. I'm your host, Marie Vakakis, and today I have with me a policy geek, a self-described policy geek. So Jack Whitney is involved in policy and advocacy and has had a lot of experience moving up through different organisations and services, both in a voluntary and paid capacity, and is really passionate about policy. I'd like to start today by acknowledging the traditional owners of the land on which we podcast today. So I'd like to acknowledge the Wurundjeri people of the Kulin Nation and pay my respects to elders past, present and emerging. We have had such an incredible last few guests. So hearing from Caitlin last week about her experiences in the Northern Territory were really, really interesting. And listening to Kate a couple of weeks ago about job hunting. So if you haven't caught those yet, check them out when you're ready, when you have a bit of time. And for those listening, would really appreciate if you could put a rating or review and like the podcast wherever it is you get your podcasts from. It really helps more people hear about the Inside Social Work podcast and an opportunity for our guests to reach a wider audience and share their stories with more listeners. So yeah, whenever if you get a chance, that'd be really great. We can also, we're building up the Inside Social Work Facebook group. So if you want to pop in there, you can chit chat, post some questions, and contribute to some of the episodes that we're recording. Recently, we've put out a request to share some self-care tips. So if you're interested, you can send a little voice recording to me at Marie, M-A-R-I, at InsideSocialWork.com, and I'm compiling some episodes on self-care. Anyway, without further ado, here is my episode with Jack. Okay, welcome to the podcast. I'm talking with Jack Whitney. Jack Whitney. I'm so sorry. What a great start. Welcome to the podcast, Jack.
Hi there, Marie. Thank you for having me today. And my name is Jack Whitney. I'm president of the Australian Association of Social Workers here in New South Wales. I'm a social worker that's worked across domestic violence, child protection, and in the policy realm. And I'm currently a manager at Sydney Children's Hospital Network, where I manage diversity health unit. But I'm also involved in social work leadership roles on a number of boards, including the New South Wales Council of Social Service and Youth Action, and the Institute for Healthy Communities Australia.
That sounds like a full schedule.
Yeah, it's a busy time. It's a busy time, but it's great to be here. And I just want to acknowledge that I am speaking on Aboriginal land, and I want to acknowledge the traditional custodians whose land that we are meeting. We are all on Aboriginal land, and the continuing connection of Aboriginal and Torres Strait Islander people to this land, and pay respects to elders past, present, and those of the future, and those tuning in.
Great, thank you. So you mentioned, you're involved with the AASW as well as a few other bits and pieces. Could you rewind your, career back and just let listeners know where you started and some of the things that you've done on your journey in social work?
Yeah, sure. So I would say that my social work journey really started at university, where I was involved in student welfare and student governance, and some call it student politics, and where I ran on a student welfare platform. And I was really aware that students were doing it really tough. When I was studying social work, I heard that some students were going out with food, and in particular, there was a lot of stuff happening on campus when Tony Abbott became Prime Minister, and there was a lot of cuts to education. And there was also a whole lot of things happening for international students. And I saw that as a real problem as a student on campus, but also as someone studying social work, where we're looking at access and equity and outcomes for the different populations, and ensuring that that there's a fair distribution of resources and for the like, even from a mental health perspective as well. So from that point, I got elected to the student board and SRC, and I was involved in a lot of different campaigns. So I was very much involved in like political and radical social work practice. That's what some call it, but I call it just being involved in your civic duties. And then I graduated, and I sort of dabbled a bit in doing community organizing and holding some roles in political staff roles. I also interned at Human Rights Watch, where I looked at a lot of human rights violations internationally, but also locally around refugees and asylum seekers. And that was a great experience. And then I went to working in hospitals, which was very different in the sense that on the front line and actually seeing how the vulnerabilities and the inequities that people were experiencing directly and how that had an impact on their health. So I started at Hawkesbury Hospital, where I was one of 2 social workers across the whole hospital, delivering maternity, ED, surgical, general, pediatrics, and then I went into Liverpool Hospital, which is a major tertiary hospital, and that was working in maternity and pediatrics specifically, and that was a great role to sort of really cut my teeth into. And then I went into a policy consultant role, where I worked with federal government on a lot of federal government initiatives, from domestic violence right through to public health initiatives and Aboriginal and Torres Strait Islander communities. I worked for an Indigenous agency, and then in my current role, which is at the Children's Hospital, where I manage the Diversity Health Unit, delivering strategy and policy across the hospital network to improving outcomes for different population groups, from people with disability to LGBTIQ populations, and to cold populations, refugees and asylum seekers, to deliver equitable resources and care across the hospital. And while I'm doing this, I'm president of the AASW, which sort of feeds into this sort of policy work. Convener of the Gay and Lesbian Rights Lobby as well, which I forgot to mention, where I'm very passionate about that advocacy work.
That's quite a lot there, and you're a self-confessed policy geek as well, so that makes sense. That journey into policy and advocacy.
Yeah. I see policy as really a great way to sort of bring social work into a realm that I think a lot of us are sort of uncomfortable with, because we are so interested in and so well equipped to sort of delivering initiatives face to face on the front line, through our counselling and therapeutic work and our group work and our family work, and even on a community development level on the ground in a grassroots kind of way. But actually, how do we make policy that is making changes on the ground? How can we have the left and right hand working together, and so to speak, with at the coalface, but also linking that in a co-design sort of way? So where I went at Inside Policy, which was that Indigenous agency, I worked across Australia delivering different initiatives, and in particular, I was part of developing a wellbeing outcomes framework for Aboriginal and Torres Strait Islander children, and that was a whole of government approach and framework to look at how they're funding and delivering initiatives to Aboriginal and Torres Strait Islander children. So I co-designed that wellbeing outcomes framework with Aboriginal and Torres Strait Islander communities, in dry communities, but also in just rural, remote communities and metropolitan areas. Really, and that was about speaking to communities about what is the best outcome for children, what does the best life for Aboriginal and Torres Strait Islander children look like, but also coming in with that social work perspective and that social work lens that there's power in this, and me coming into the situation, there's a power dynamic, and also as a white fella, and from a government perspective as well, and being able to have those sort of conversations in a way that enables for solutions to be identified by community, and not placing your own viewpoints and values onto different communities as well. And I worked with like lawyers and those sort of brains which had a very different way of working. So I think we need more social workers who are more policy geeks.
And I really like the emphasis on that co-design and working with people, which we know has really, significantly better outcomes because you're not kind of coming top down and just implementing something where people aren't on board all those practicalities that maybe haven't been considered for those on the receiving end. I wanted to, it might be a hard example, so you feel free to think of a fictional example, but how would you explain to listeners what good policy looks like versus bad policy? So how, something can be created that is actually effective and how something can be that's not.
I think bad policy. So I grew up during John Howard, and one day Kevin Rudd became Prime Minister, and I assumed, and then I learned about this thing called democracy, because I just assumed John Howard was our dictator as a kid. But I learned a lot about the intervention, and when working in this place, in that role, I saw the impact of what punitive sort of policies can make on a community.
You're referring to the Northern Territory intervention?
Yeah, correct.
Yeah. So for those listening, if you're not familiar with Australian history, you can do a bit of a search and find out a bit more about that.
Yeah, absolutely. And so that's a policy and a government way of working with communities that are that further propagate this stereotypes, but also it doesn't do anything to improving outcomes. It doesn't do anything to working with communities on a therapeutic level or on a equal level. So when I came into this role, and it was actually about working with communities to identify solutions and not to impose solutions which are, I think for everyone that can agree, problematic. So I would say that's, a bad example of policy. And what good policy should be is about seeking to improve outcomes for vulnerable groups and involving the ethics and values of social work, which is about equity, social justice, access, which are, universal and indivisible. And people in government need to better engage people like social workers or professions like social work in the pursuit for equal treatment and protection under policy and law, because what we need is a cultural understanding. We need to have an impact of history and the impact of trauma and loss, the recognition of human rights, the impact of racism, stigma. I think as well, in good policy, there needs to be, when working with these communities as well, the recognition of kinship and family is very central, cultural diversity and strengths and things like that. So in any policy as well, and in good policy, there needs to be a responsiveness and awareness, safety for communities, all communities. They need to be informed and holistic, and as well as self-deterministic.
Yeah, there's so many things to consider, and I think social workers are so well placed to consider all those different components and look at the sort of macro and systemic levels of how we interact.
Yeah.
A lot of our guests in the past, working in a direct practice role, they pick up additional like training. They might do work in trauma or CBT, like they pick up additional sort of things. What sort of things would you recommend or have you done if you want to really focus in on policy and advocacy? Are there any additional trainings or things that you've invested some time in to increase your skill set, or other people looking to get into that kind of work should look at?
Yeah. So as a relatively young professional, in person. There's only so many things that you can do in your job, because in your job, and it depends what your job is, but there's a hierarchy, there's a structure, there's defined roles, and there's a lot of different legislation that sort of impacts your ability to sort of develop your skills in a real sort of practical way without outside of training and further education. So what I did and what I saw as really important is that I sought out roles outside of my job in a volunteer or in a stipend honorarium sort of way, where I did it outside of my job, or I did it outside of work hours on the weekend, and there were sometimes elected roles on a board where I got I had an ability to sort of make important decisions, work with different stakeholders like government or politicians, meet with politicians, write a submission, work with different staff to write policy submissions and present at inquiries, doing that important stakeholder work, which really in a full-time job or in a job when you're starting out, or even, not even starting out, you don't really get until you've had those years of experience prior. So I would say for anyone listening, if you want to learn policy now, if you want to, even as a social worker in your full-time role, or even, leaving social work and finding a role outside of that, look for roles where you can sort of do that policy engagement with an advocacy organization, whether it's your professional association like the AASW, or whether it's another organization that you're passionate about personally. Mine was, for example, the New South Wales Gay and Lesbian Rights Lobby, where I was elected co-convener, and I still get to meet with politicians and engage on that level, and do media, write opinion pieces, and have my name out there, but also running for a board that is a peak organization that is really important to members or other member organizations, and having a say and doing that assessment on a governance level, because governance is also about management and that broader thinking and strategy and policy, whether it's risk or whether it's finance or whether it's HR, that sort of stuff. And that's why I'm able to speak the language this way at 27 years old, because I've been able to run for things and be fortunate enough to have that opportunity. So I really encourage social workers to do that.
Yeah, that's really interesting. And I think a lot of the guests have kind of mentioned that you can get involved with lots of things in an area that you're interested in. It's something I definitely encourage my students to do. Is no one job has to provide all the bits.
Absolutely.
And as much, and I'm a very big advocate for getting paid your worth, but there are also opportunities to do volunteer work or to be working alongside someone, which is, it's different to, I guess, being paid your work if you're choosing to volunteer and build your skills and contribute and upskill. I think they're very important things. So a lot of those things you've done have sort of slowly added skills, which then got you probably another position, which added skills and all the way through to where you are now. Anything more formal, anything
like
around
further education?
Like writing skills or co-design, any sorts of things like that, because they're all terms that I think people are familiar with, but maybe don't know how to go about it.
I think so with co-design and sort of the consulting sort of world, a lot of that sort of experience came through looking at different courses, whether it was through a lot of different civil society organizations. They are partnering with like private sector, so looking at Deloitte, KPMG, PwC, those big firms that are sort of partnering with different civil-based organizations and delivering training. There's different organizations in different states as well. So mine are New South Wales Council of Social Service and Youth Action New South Wales, who are the sort of peak bodies for young people, and then the community sector. And they deliver training as well, and upskilling and capacity building, and run different courses. There's also a lot online. So there's the Australian Centre for Social Innovation. They do courses which provide opportunity for a lot of social workers to do that sort of upskilling and capacity building. Even a lot of literature. So I read a lot of like political and radical social work for that policy and systems level analysis and intellectualization, whether it's, you know, the sociological imagination by C. Wright Mills, right through to Fouque, or to you know, more current writings. And what we can also look at is you know, further study. I've done a master's and finishing off the latter part of it in public health and health management and leadership. So really looking at those further qualifications, whether it's and, you know, besides a master of social work, or besides a something specifically in our field, broadening out to that management or MBA or Masters of Public Administration or policy studies even, which sort of help in that way, and which can be very complementary to any current work or voluntary experience that you're doing. But also to that, when you get into these roles that I was talking about before, opportunities come up as well. So, for example, as president of the AASW, I'm doing governance training, which is offered to branch presidents, which is done through the Governance Institute, or even, you know, through the Australian Company Institute of the Australian Institute of Company Directors. On the boards I'm on, they offer training as well. So I say, just to get your foot in the door and even try and find those opportunities, put your hand up for something, run for it, and things come out of that as well.
Yeah, that's fantastic. It really shows the journey that you can take, and sometimes very intentionally, and sometimes things just pop up that you find interesting, and that takes you to something else that you find interesting, and create a whole career out of it.
Yeah, it can be very relational as well, and based on relationships and who you know, who's around you. Because what is sometimes helpful is speaking to people on that level who have the same interests as well, and you sort of emerge in conversation and through dialogue, and when you meet others and in meetings as well, things come out of that, and it's really interesting sort of seeing how that happens. So I really encourage your listeners to sort of pursue those interests.
Absolutely, I would encourage them to do the same. One thing I wanted to ask you is, how do you keep maybe reminding yourself not to lose sight of the real world impact? So how do you, I know when students are doing a research project on as part of their placement, or they're in a policy role, they can feel really disconnected from the kind of human to human work that they maybe thought they were doing, or they find it really, you know, sometimes they lose sight of what impact sort of behind the scenes work can have. What are some of your advice, or anything that you've sort of found that's been helpful for you to remember the impact that policy or research or anything that sort of sounds administrative but can really have a huge impact on the lives of people that we want to work with?
So working with people on a daily basis versus working in the policy landscape, there is a big divide, and I felt that quite strongly when I was at Inside Policy, doing that evaluation and policy development in an office in the city, when I was speaking about, you know, Indigenous affairs and the impacts in rural remote areas. And that's why it was very important for me in that role to go out to, you know, communities to do that co-design process, and working on the front line, working in those communities to co-design that on their level, and bringing it, you know, starting where they're at. And that's when bad policy is also created, where it's not done in partnership or in dialogue. what I also see as important, what we can do is, and I think what we do very well as social workers is that we are able to use our experience at the coalface, and linking that into policy, whether it's at a hospital doing quality improvement or research, and looking at how gaps are identified in clinical services or in any service based off patient need or client need, and linking that into policy in a hospital system or on a district level, or even in taking it and gradually over time taking it on a government or a New South Wales or state-based level. When we're talking about advocacy as well, advocacy for me is speaking truth to power. So speaking truth, the words of others, to people in power and politicians and the like. And you can't do that if it's not in partnership with the community or on a grassroots level. So it always needs to be, there needs to be a multi-pronged, top-down, bottom-up approach in all of this work. And I think social workers are well equipped, skilled, and empathetic and connected enough to do that. And if they don't feel like they are skilled enough to do that, that's where this sort of training comes from, and just putting your hand up for something, where these sort of governance and training can come into, but really drawing on your ethics and your WSW ethics and code of ethics and values to sort of complement that training, because a lot of this training is very business and corporate. So never lose sight of your core social work values.
That's you said that so beautifully. There were so many, I guess, words of wisdom in that, and really looking at the values and bringing it back to why we're doing what we're doing.
Thank you.
Would you in your role have, the equivalent, like what would your equivalent be of, or maybe you have like supervision, like if that you'd still be at risk of burnout, and there'd be vicarious trauma and compassion fatigue, all the things that on the ground sort of consumer facing roles have. How do you manage that on a policy level? Because I would imagine it maybe doesn't get the same recognition, but having friends who've worked in things like coronial inquests and where they're reading lots of like things where you're digesting lots of information, even if it's at an arm's length from the people themselves. And I imagine policy and co-design would involve a lot of that too. How do you keep burnout at bay, and what is your self-care and supervision? What's happening in that space for you?
Yeah, what I would say to that is that I surround myself with a lot of mentors and people who I'm able to reach out to on a semi-regular basis, who I've met in different roles. So I, like, for example, at Liverpool Hospital or at St. Vincent's, or even in my consultancy role, or even my political experience, I have different people who bring out different things and are able to, social workers as well, in those roles, who are able to provide that guidance and mentorship. In terms of supervision, it's very difficult because some of these roles, you're not in specifically a social worker role where supervision isn't automatically supported or talked about or set aside or protected, or given protected time. So really, setting as a worker and as an individual, really making that as a focus and using your relationships to sort of have that time set aside. What I do is I have my monthly catch up with my mentors who give that supervision. My supervision is always quite casual, because I'm quite casual in approach with most of my things, but I really like to debrief. I use my supervision to sort of intellectualize different policy and what the next steps are within different initiatives, but also recapping and refreshing, and what's the next thing, because you can't, with a lot of these things, it's different to the band-aids that we are often doing a lot of the time, and it's more macro and it's there, but really you can't stay around for it to, monitor it in a lot of ways, because that's up to government or up to a different sector. And it's really about what's the next fight ahead. And that's what I focus on. And that's what keeps me driven and going and passionate. But also it's a good way of coping with the pressures that come with this sort of work. And that's just my experience.
Yeah, and I think what you were saying around like having mentors and peers and people in your network really rings true for a lot of people in that advocacy space, where you can look back and have gratitude and look at what you've achieved, but often there's still so much ahead that having other people who understand what you're going through and sort of either fighting the same fight or advocating for the same cause, or just have that awareness of what you're doing and how you're being intentional about it can make you feel supported and have a bit of a community.
Yeah, absolutely.
Before we sort of wind up, or wrap up, are there any sort of things that you would encourage sort of new graduates or students who are close to graduating to think about when, choosing their career path, or about getting involved in stuff if they're feeling like maybe I don't know enough, or I can't really contribute yet, or I know for me, I've always avoided politics. I'm a terrible writer and I have no attention to detail, and there's spelling mistakes everywhere. Like, what are some of the things that bits of advice or things you can share with listeners?
Yeah, I guess in terms of it's funny enough, like with policy work, you are doing a lot of writing. So what my advice is that, uni is a great preparation for it. So really using uni as a good opportunity to sort of taste test different things, whether it's, running for student office, or, that campaign stuff, or student rights and welfare, to writing essays, to doing that research, which comes with policy as well, but also that stakeholder work that is very central to that. I wouldn't even call myself a very strong writer. I would say that I write different pieces for media and stuff, and that's different sort of writing to academic writing for one, and even policy writing. I think what the skill is, though, is being able to use different audiences and avenues to talk about different issues, which I think social workers are well equipped at, from, speaking to the client in a counselling room or in a patient care situation, to a casual sort of encounter as well, and being able to tailor that, and even, taking it into a more advocacy space as well. To, graduates and people at uni, I would say, do that taste testing, really figure out what you want to do and what you like. University is a great opportunity to do that. That's what I did. I would also say get involved in the AASW, the Australian Association of Social Workers, especially if you're in the New South Wales branch, and meet with me, and I'm very happy to support you and mentor you. But what as well is, it's a good opportunity to sort of experience that policy and advocacy work from a social work association perspective, and that can give you a leg up, or an opportunity to sort of engage on other organizations. What I did was that I was very passionate about the civil society and community sector and social services, so that's why I'm on NCOS and Youth Action, and involved in healthcare and public services as well. So really using an opportunity to sort of engage in your professional association can be a great way to do that. And it's only $40 to $50 as a member. Just plugging that.
No worries. So I'm really hearing you sort of encouraging people to just to get out there and put themselves out there and network and give things a go and be involved. And hopefully, I think as you do that, your competence grows, and then your confidence grows, and it's a bit of a cycle, isn't it, really?
Yeah, I think it's sort of like exposure therapy. Really just doing it again and again and again, and you sort of develop that skill, but also that the adrenaline that you experience when you present or when you go to a conference, that nervousness that comes with that. Like, I still get nerves when I present or when I'm speaking at an inquiry, but because I've been doing it enough, I sort of use the energy and the passion to sort of take me to the next level, which I think we should all do in our work when we're speaking about, whether it's when it's speaking to a client directly or speaking about a policy or an inquiry. And it can be difficult at first. And I don't think social workers are normally comfortable with that or don't usually engage on that level. But the more of us that are doing it, the better that policy will become, and more informed it will be for populations that really need it and that are vulnerable and doing it tough. But we also know as social workers that these communities hold the answers to their solutions and that we can enable access to them as a profession.
Absolutely. Thank you so much, Jack. Before we go, are there any sort of resources or books or anything you sort of want to recommend to people? If you can't think of them now, we can add some in the show notes. But anything off the top of your head that you think's worth people doing a bit of extra reading?
Yeah, anything that is titled political and radical social work, that would be great. Building up your literature on that. There is the Institute for Political Social Work, the School for Political Social Work at the University of Connecticut and Austin University in the US. They have a lot of literature there about policy work and working with government around social work matters, but also social work as political, and doing that policy work. The Sociological Imagination by C. Wright Mills, where he talks about private issues and public issues and the linking between, say, for example, the private issue of mental health of an individual, but reflecting on the fact that 1 in 4 people experience mental health. So what is happening on a structural level that we need to improve, and what are the solutions for that? And really, social work has been that conduit or in between to sort of navigating that landscape. So there's some really useful resources that I've had in my past.
Great. Well, if you think of any more, you send them over and we can add them in.
Will do.
Great. Well, thanks so much. It's been such an interesting conversation. I always learn so much, and I'm always constantly amazed by the variety of roles that social workers can get into and how we can use our skills across so many different sectors. It's really incredible to hear your social work journey.
No worries. Thank you for today, and thank you for all that you're doing, and I hope that your listeners get a lot out of it.
I'm sure they will. Thanks, Jack.
No worries. Thank you for having me.
Thanks for listening. I hope you enjoyed my interview with Jack. Feel free to share the episode with other social workers, anyone who you think would be interested in listening and finding out a bit more about working in policy or advocacy. And there'll be some links in the show notes where you can find some of those resources that Jack has mentioned in our interview today. Have a great day. Bye.